medical doctors we talked to today said they were promised 600 doses back in December. And here we are months later, and that promise has yet to be fulfilled. And they say it's their patients who are suffering. This refrigerator is filled with different types of medications and vaccines. What it doesn't have are the doses of the COVID-19 vaccines promised to local primary care physicians.
It's kind of consistent with how COVID has been from the beginning. We struggle to get protective gear. We struggle to get adequate testing samples. And now we're struggling to get the vaccines.
Dr. Salerno of Salerno Medical Associates told us the government has yet to make good on a promise of vaccines they made back in December.
We were approved when we applied back in late 2020 as a site to receive vaccines, and now we're in mid-April and we still haven't received one dose of any vaccine.
We know that Black and brown communities were the hardest hit during the pandemic, but as more members of those communities are encouraged by churches and clergy, community-based primary care physicians say they should be included when vaccines touch down locally because it increases access to underserved communities through their offices.
Primary care centers and we're a place of treatment and a place the patients can go to because they had confidence and they had relationships, no different than you would with a pastor or a barber or anyone else.
I live in the neighborhood and it's just a few blocks away, so it would be great for me to just be able to come here and have the shot taken.
Vaccination rates are still below average in some communities, and though megasites are now open in our state, there are still residents who have trouble getting to vaccination sites.
People in these towns, I know a lot of people that's looking for the shots and they gotta travel and they don't have no way to get there and stuff. So yeah, the more local spots, the easier it is for people to get to it.
Naomi, I probably doubt in here that vaccine supply is the only frustration in that area. I mean, you've been out talking to residents. What are you hearing about the other challenges that are in play here?
So we're talking transportation, just like that last gentleman said, Mr. Fields there. He said some people just can't get there. They have no vehicle to get there, no car to get there. And so it's easier for them to maybe walk to a local office or catch a bus nearby. But they're also finding that, and this is what the doctors were telling us, is that they're finding that your local doctor's office may be more flexible with the hours. So maybe you need to come in a little bit earlier to get your shot, or they might stay open later so you can come in after work to get your shot.